So we are going to start with the definition of COVID virus disease. It is an infectious disease which affects the respiratory system, and it is caused by the coronavirus, that spread primarily through the droplets of saliva or from the nose when the infected person sneezes or coughs. The symptoms of this disease vary from mild to moderate respiratory illness. The virus was first discovered in Wuhan City, China in December 2019, as you are all aware, and it has currently spread to many of the countries, including Kenya. The global situation, can you hear? There are a total of around 110 million people who have been infected by the virus, and a total of around 2.4 million worldwide. In Africa, currently we have 2.8 infections, while the situation in our country, in Kenya, we already have around 104,000 people infected as at yesterday. Of these, around 1,827 people have died, while we have around 80,000 who have recovered. Currently, we are having average infections of between 100 and 200 people daily, and people are still dying of this disease. How this disease spreads? The virus is mainly transmitted through droplets, which are generated when an infected person coughs, sneezes, or exhales. These droplets quickly fall onto the floor or surfaces, and one will get infected by breathing in the virus or when we were within close proximity of someone who has the COVID-19, or if you touch a contaminated surface and transfer the virus to either your nose or your mouth. Effects of the virus on your body. The incubation period will be between 2 and 14 days on average, which is around 5 days, so around 1 week. And then the virus will colonize the mucosa of your respiratory system. But the main target is the lower respiratory tract, where it will cause inflammation of the mucosa. Then the body now will respond by triggering the immune response mechanisms, which will try and fight this virus. What happens to the body after you are infected with the virus is what we are going to look at under the effects of the virus on your body. First, your body will trigger what we call cough as a reflex to try and clear the respiratory tract. Then there will be accumulation of the exudate or the fluid, which will be in the alveoli of the lungs. And this one is going to interfere with the gaseous exchange, and then also decrease the supply of oxygen to other body tissues. Then at the end, you are going to have general body weakness, fatigue, and a headache, and other symptoms which are corona-related, which will include difficulty in breathing. Then there will be fever or elevated body temperature. The infection will continue, and some of the alveoli or the functioning portion of the lungs are going to collapse. Then the oxygen supply will become less. Then what will manifest will be what we call bluish discoloration of the mucous membranes and breathlessness. then the disease is going to progress and be seen in all the other body systems, which we call systemic manifestations. And these symptoms are going to vary depending on your age and your immune status. How will you tell when somebody has coronavirus disease? There are common symptoms which include fever or chills. There will be cough. There will be shortness of breath or difficulty in breathing. There will be tiredness. Then the other common less symptoms will include body ache and pains, sore throat, headache, loss of taste or smell. How do we treat this condition? For now, there is no known cure, but prevention of the infection is the only available treatment. Currently, the government of Kenya has ordered some coronavirus vaccines which are expected to be rolled out as from this month up to June 2022. So the cure for now still remains prevention.
Okay, prevention. We are going to look at the preventive techniques. And we have around 3 of them. Okay, the techniques include the sanitizing or hard rubbing technique, safe use of mask. The appropriate use and storage and cleaning or disposal of masks are essential to make them as effective as possible, because you might be doing all the best to prevent yourself. So you might, the way you store, the way you handle your mask is very important. So the World Health Organization advises that the general public should wear a non-medical mask. Individuals with the higher risk of severe complications from COVID-19 should wear medical mask. Then we are going to look at the technique. How do we wash our hands? How do we hand rub? And how do we wear the mask? So, wash hands when visibly soiled. Otherwise, you use hard rub. The duration of the entire procedure is 40 to 60 seconds. So we will start with technique 0. Just to follow we will move with the techniques from 0, 1, 2, 3. So you be observant. The first thing you do is that you wet your hands with water. I know most of us put the soap first, but for the right thing is you wet your hands with water, as you can see at 0. Then apply enough soap to cover all the surfaces. Number 2, you rub hands palm to palm. And technique 3, right a right palm of a left dorsum with interlaced fingers and vice versa. Then number 4, as you can see the arrows, that's how the hands are moving up and down. Yes, then you go to technique number 4. The palm to palm with the fingers interlaced. Then back to fingers to opposite palms with the fingers interlocked. Then number 6, rotational rubbing of left thumb, clasped in right palm and vice versa. As you can see the arrows, this is a rotational movement. Then 7, rotational rubbing backwards and forward with clasped fingers of right hand in left palm and vice versa. Up to there, you have made your hands clean. So the next step, that is step 8, you rinse hands with water. After rinsing your hands, after you rinse your hands, after rinsing your hands, procedure 9 is you dry hands thoroughly with a single-use towel, maybe the serviettes. Then procedure 10, before you throw this the drying towel, you use it to turn off the faucet or the tap. Then your hands will now be safe, and the whole of this procedure takes around 40 to 60 minutes. Let's look at the next the hard rub hands for hand hygiene and wash hands when visibly soiled. So the hand rubbing technique takes 20 to 30 seconds. Takes 20 to 30 seconds. As you can see for technique 1A, the technique 1A, that's the source of your sanitizer. It can be either the one you press like a spray or the one you pour on the palms. So after you pour, apply a palmful of the product or sanitizer in a cupped hand, covering all surfaces. Then step 2, rub hands palm to palm. And step 3, right palm over left dorsum with interlaced fingers and vice versa. Just as you can see the arrows on the diagram. Then palm to palm with the fingers interlaced. Then procedure 5, backs of fingers to opposite palms with the fingers interlocked. Then step 6, as the arrows are showing a rotational movement, the rotational rubbing of left thumb clasped in right palm and vice versa. Then the rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are safe. As you have noticed, the procedure is similar to hardship. The only missing step is the rinsing and the drying. Of course, they won't dry and you won't rinse because you want to have disinfectant left on your hands. So the next preventive measure in COVID-19 prevention, we said we have the hand washing and hand rubbing, then the wearing of mask. You must wear your mask safely. And here we have the procedure on how to wear a medical mask safely. We have the do's and don'ts. Let's start with the do's. What do you need to do when using the mask? Wash your hands before touching the mask. That should be the first thing. Before you wear your mask, wash your hands. Then inspect the mask for tears and holes. Then find the top side where the metal piece of the stiff edge is. This is for the note that we are dealing with the medical mask. Then ensure the colored side faces outwards. Place the metal piece or stiff edge over your nose. Cover your mouth, nose, and chin. Then adjust the mask to your face without leaving gaps on the side. The next thing you need to have in your mind is avoid touching the mask. Always never touch your mask. Then remove the mask from behind. As you can see from the diagram, from behind the ears or the head. And always keep the mask away from you and surfaces while removing it. Discard the mask immediately after use, preferably into a closed bin. And then wash your hands after discarding. Note that this is a medical mask. It should not be reused. As a reminder, mask alone cannot protect you from COVID-19. Maintain at least a 1 meter distance. The longer the distance, the better, like 1.5. So, but at least 1 meter from others, and wash your hands frequently and thoroughly, even while wearing a mask. Then we have let's look at the don'ts when using a medical mask. The don'ts include the following. Do not use a ripped or damp mask. Do not wear the mask only over mouth or nose. Do not wear a loose mask. Do not touch the front of the mask. Do not remove the mask to talk or to talk to someone or do other things that would require touching the mask. Do not leave your used mask within the reach of others. And do not reuse the mask. Note that do not reuse the mask. And always there's a reminder that mask alone cannot protect you from COVID-19. What you need is to maintain at least 1 meter distance from others and wash your hands frequently and thoroughly, even while wearing a mask. Then we see the surgical mask, or we call them medical or surgical mask. Then let's look at the fabric mask. The fabric mask. How to wear an non-medical or fabric mask safely. What are the do's? We have also the do's and the don'ts. Remember that when you are starting, we say that the World Health Organization advises the public. If you know you are not in the group of those at high risk, and the high risk groups include the pregnant and with a compromised immunity, you are advised to use fabric mask for economic purposes, because there's one time they went out of stock because people who are strong used the medical mask, and the at-risk people used the medical mask, and it was out of stock, and that's how Corona defeated us. So an advice from the World Health Organization is that if you are not in the category of those at high risk, use the fabric mask. So the first do, clean your hands before touching the mask. Then inspect the mask for damage or if dirty. Adjust the mask to your face without leaving gaps on the sides. Cover your mouth, nose, and chin. Avoid touching the mask. Clean your hands before removing the mask. Remove the mask by the straps behind the head. Then pull the mask away from your face and store the mask in a clean plastic reusable bag if it's not dirty or wet and you plan to use it. Once you've sealed it, how do you remove it? Remove the mask by the straps when taking it out of the bag. Wash the mask in soap or detergent, preferably with hot water, at least once a day. Then clean your hands after removing mask. As a reminder, a fabric mask can protect others around you. To protect yourself and prevent the spread of COVID-19, remember to keep at least 1 meter, and the longer the distance, the better, 1.5, 2 meters, but at least 1 meter distance from others, and clean your hands frequently and thoroughly, and avoid touching your face and mask. Those are the on the fabric mask. Let's now look at the don't. The mask. How to wear a non-medical mask fabric, a non-medical or in other words fabric mask safely. What are the don'ts? Do not use a mask that looks damaged. Do not wear a loose mask. Do not wear the mask under the nose. Do not remove the mask where there are people within 1 meter. Do not use a mask that is difficult to breathe through. Do not wear a dirty or wet mask. Do not share your mask with others. My reminder is that a fabric or non-medical mask can protect others around you. To protect yourself and protect the spread of COVID-19, remember to keep at least 1 meter distance from others. Clean your hands frequently and thoroughly, and avoid touching your face and mask. Then management of COVID-19. Then
when you are thinking about management of COVID-19, you are thinking about a patient or someone who has been confirmed to have the case already. So this is someone who has been infected with COVID-19. Maybe there was a problem with the prevention and therefore they were not able to protect themselves from COVID-19, and now they already have a COVID-19 infection. So what you should do is to always ensure that they self-isolation. We have heard about people going on quarantine, and this means staying home except when you have to get medical care. And these people who have been confirmed to have COVID-19, you should always stay at home. And even if you have a mild illness, it is just important to stay at home so that you do not infect the others. So do not leave your home except to get medical care. Do not visit the public places. And the need to self-isolate is important because as you self-isolate, then you will be able to protect yourself from even further infection and also protect the others. So sometimes you have not received your test results, and therefore you may need to stay at home until you get the test results. For example, you are suspected to have had the case. So once the specimen has been taken before you get the results, then you need to self-isolate. And we have seen that happen for people who have been said to be exposed to the infection. You need to take care of yourself, and taking care of yourself means while still at home, get some rest, stay hydrated, then stay in touch with your doctor, of course, because you may have some features that you may need the doctor to address. And then you need to call before you get medical care. Before you visit the doctor, let them know that you are going. And be sure to get care if you have trouble breathing, because that is one of the worst things that can happen in COVID-19. Or if you have other emergency warning signs, or you think that whatever you are having as a feature is an emergency. Then avoid public transportation, ride sharing or taxis, because of course you are going to infect the people whom you share those public transport with. You need to separate yourself from other people and the pets in your home. It has been known that even pets will spread this COVID-19. So if you infect the pets, the cats and the dogs, then they can also pass to the other people in the homestead. So as much as possible, stay in a specific room at home, away from other people and the pets in your home. Then you need to use a separate bathroom if available, and you need to be around other people. If you need to be around other people or animals or outside of home, then you need to wear a mask to ensure that you do not infect the others. Okay, the other thing you need to do is to monitor your symptoms. The symptoms of COVID-19 include fever, cough, and shortness of breath, but you may also have other symptoms as well. So you will need to follow the care instructions from the healthcare providers and the local health authorities, and this constitutes the community health workers, can give you instructions on how to check your symptoms and also to report and what information you need to report. For example, if the symptoms are becoming worse, then this is where you can report in your locality. Then when do you need to seek emergency medical attention despite having stayed at home? You need to look for emergency warning signs for COVID-19. For example, if someone is showing any of these signs, then you need to seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, some new confusion, that is confusion that was not there before, bluish lips or face, inability to wake or stay awake. And we also need to be on the lookout. When you are on the lookout for those signs, then you can always visit the hospital on time before it gets worse. But be cautious. Before visiting the doctor, always call ahead. And when I'm talking about calling ahead, the first primary health provider for us is the University of Embu Health Unit. And they have given us a number, 0795-188740, where we can always call before we visit if we think we have the signs of COVID-19. In case you are outside there, you can also contact the county hotline numbers in Embu. They said 0769-167-832 or 068-233-1056. All of these are toll free. And in case you are away from Embu and away from the university, that is, then you need to can call the COVID-19 emergency call center. It is 719, and so it's also toll free. You can text them, the Ministry of Health Kenya, *719#. And of course, for other medical appointments that you could be having, always call and inform the facility before you visit them. For example, if you contract COVID-19 and you already had another pre-existing condition, before visiting maybe the clinic that had been given to you, it is important to call them and inform them that you are going and you are suspected to have COVID-19 or you have already been confirmed as having COVID-19. So, but when can you be around others after you had or likely had COVID-19? That is, after you had been suspected to have COVID-19 or had been confirmed as having COVID-19. When can you integrate with other people? So depending on your healthcare provider's advice and availability of testing, you might get tested to see if you still have the COVID-19. So you can repeat the COVID-19 test to see that if it is still positive or negative. So if you will be tested, you can't be around others when you have no fever, symptoms have improved, and you receive 2 negative test results in a row, at least 24 hours apart. But it is important to note that one may be COVID-19 positive with or without symptoms. So sometimes tests have been done randomly and some people have been found to have COVID-19, yet they didn't have the symptoms. So it is important to note that. The other very important thing that you need to do while you are at home because of COVID-19 or when you are recuperating is about looking after your mental health. Of course, being stuck in isolation could be isolated alone or with other people who have COVID-19 for an extended period can be stressful to everyone. But you can take steps to ensure that the experience isn't as lonely as it is said to be. So, of course, keeping in touch with friends and family members. This can be via telephone, emails, or social media. The use of technological devices, the phones, the TV, they are good company for people who are isolated, but of course they never need to be over-relied upon. For example, the TV can be damaging to the eyes if watched for a long period of time. But it is important to note that you can use the time to do some of these things that you never actually do or you never actually have time to do. For example, drawing, reading novels, newspapers, articles, and also doing some craft. And that, by so doing, you have occupied your time while in isolation or while you have been suspected to have COVID-19 and put on quarantine. So I'll invite my next colleague to take us through home-based care for people who have been told to stay at home because of COVID-19 and be taken care of at home.
Thank you very much. My name is Judy Tuanjiro. I'm going to take you through home-based care. So how should you isolate yourself? As you have seen it, you are there. So as you have seen, when you are diagnosed with COVID-19, you are supposed to stay at home. But how?
Okay, I'm sorry for the delay. So how should you isolate yourself in home management? As you have been diagnosed with the COVID-19 or you are suspected and you need now to isolate yourself, these are the things you are supposed to do at home. First is how should you isolate yourself? One, separate yourself from other people in your residence in a well-ventilated bedroom. If possible, your family, so colleagues should not stay or sleep in the same room as you. If you have to share a bedroom, Clean after every use. And remember, you clean with soap and enough water. Avoid sharing items at the same spaces with other people in clean services often. For example, the sharing of towels, soap, and even the soap dishes. You should use your own items, and even the basin you are using should not be shared. Stay at least 1.5 meters. That is three steps away from other people at home. The following are the remedies to relieve the symptoms. We saw in the earlier presentation the common symptoms which you can present with, but these are the following remedies can help you to relieve the symptoms. Use the usual cold and flu remedies to relieve symptoms. For example, take Panadol for fever and pain. Drink warm honey and lemon water, or use lozenges to relieve sore throats. Do a warm water and salt gargles twice daily. Steam or use a humidifier with eucalyptus or fix, as dry air is not good for your lungs. Avoid using nebulizer. Traditional remedies like black seed, turmeric, ginger, and other natural substances known for their anti-inflammatory properties are not harmful and may help. That's when you are there, you must do the breathing exercise to clear your lungs and improve oxygen flow. The idea is to get the lower part of your lungs to expand so that any mucus that is collecting there can be dislodged and coughed out. Remember, after getting the COVID-19, there is a lot of secretion due to inflammatory system, and this secretion tend to settle at the lower part of the lungs. So you have to keep on exercising so that this secretion can be coughed out. Remember to only do this breathing exercise when you are alone in the bedroom. Let us start with deep breathing and forced expiration. Take a deep breath in through the nose. At the end of it, hold your breath for 5 seconds. Then breathe out through the mouth. Do this 5 times, 5 breaths, in total 5 breaths. Next, take a 6 deep breaths in, then at the end of it, cough strongly, covering your mouth when you do so. The 6 breaths plus cough at the end represent 1 cycle. Repeat this cycle twice. Let us also look at another type of breathing, which is referred to as belly breathing. Lie on your back, bend your knees, breathe deeply through your nose, align your chest and belly to expand. Breathe out through your mouth at least twice as long as you inhale. Perform for 1 minute, then rest for 30 seconds. Another type of breathing is pursed lip breathing. Breathing in through your nose and breathe out at least twice as long through your mouth with pursed lips. Preferred food to use. Let us now look at the preferred food to use. Consume more alkaline food, for example, bananas, green lemon, yellow lemon, avocado, garlic, mango, tangerine, pineapples, and oranges. Remember, this will help in boosting your immunity. So So in strengthening immune system, eat healthy meals. All meals should be warm, not cold. Avoid cold meals, they should be warm. Drink 1.5 liters of water daily. Sleep well, uh, a minimum of 7 to 8 hours. Get plenty of rest, but also remember to stay active and do the exercise as we have seen. The following supplements will help in boosting your immunity to, for example, vitamin D, zinc, vitamin B, C, and E. Do not smoke, because smoke will now add more problems into the lungs, which are already compromised by the inflammatory effect of the COVID-19. Thank you very much. Let us get our next colleague to take you through COVID-19 infection prevention measures in the University of Embu. Thank you very much.
Present. Some of the prevention is so since the advent of COVID-19, University of Embu has come up with drastic measures in order to prevent the spread of this, but ensure that both the student and staff are safe, especially during face-to-face in the university compound. There are certain safety guidelines that have been put in place in order to spread the COVID-19. Moreover, we have a committee that is responsible of enforcing this particular guideline within the university. So the infection prevention control of COVID-19. So you'll find that one of the things that has been done as strategic points of hand washing, so placed that at the entries and within the university, you are able to wash your hands, or you'll find that there are sanitizers placed there where you are able to use the sanitizer either to sanitize your hands as you come in, and these are one of the preventive measures that are in place within the university. And also, we have cleaning with the disinfectants that is usually done within the offices, and also the learning rooms or the lecture halls. That is done often in places very early in the morning. And I think most of you will notice, especially when you have the cleaners doing the cleaning around the university. And moreover, we also have the hand sanitizers within the offices. Most often as students, as you visit the offices, you'll realize that you'll be cleaning your hands within that offices. And also when you go to the exams of the CAT, you always realize that as hand sanitizers that are used for both the students in order to sanitize their hands as they do that. Staff and students are also encouraged to practice good respiratory hygiene, which include wearing masks, as we have been taught how to wear a mask in the public. Sneeze and cough as you to your sleeves or cover with the tissue as well. And if you have cough or sneeze in your hands, wash hands immediately with soap and water. These are some of the things I think you have been told where you need to avoid touching your nose, your eyes, and your mouth with your hand, in order in case you have touched the surface with which has COVID, because these are the opening within our body, which it also, the things we have to discourage also is handshaking and hugging in the student. Then social distance, which always is 1.5 to 2 meters. And if you go within the classroom, you'll find that the seats are placed considering that particular social distance, that the sitting arrangement, both in the office and the lecture halls, are put in place in a way that the 1.5 or 2 meters just social distance is observed. And the other thing that we are encouraged, I think this we have been told of the minor symptoms, such as cough, mild fever, headache, you are encouraged to stay at home until you recover. This will help in preventing others who are susceptible from getting disease. And you'll also notice that there's always temperature check, especially when you're getting into within the gates, when you're getting into the institution, is to ensure that, especially those with a high fever, they're monitored in order to avoid any suspected case getting into the university, a risk to the other vulnerable people in the university. I think those are basically the measures that have been taken in place in prevention of COVID-19 within the institution. Thank you for listening. Maybe if there's any question, we can have. Please let me hand over this back to Anna.
Thank you very much for those who have taken the opportunity to be with us. I'm sure you have been able to learn one thing or the other. In case of any questions, you can type them in the public chat in the next 5 minutes. If there are no questions, please encourage your colleagues the next time we have a training that they should join us. Thank you.